My name is Lisa Fager-Vediaco. I'm with the Congressional Black Caucus Foundation. I am the project director of the Act Against AIDS Leadership Initiative, which is an initiative of 19 Black national civil rights and Latino organizations who were funded by the Centers for Disease Control and Prevention to interject HIV/AIDS education, awareness, action and testing into what they do every day. We have some of our Act Against AIDS partners here. If you look on the back of the book that you hopefully picked up outside, you will see all the logos. I'm not going to try to memorize or say them all, but I will point out the folks that are in the room. We have Sigma Gamma Rho, who's a partner, the National Council, right there, can't miss them. The National Council of Negro Women, the Black Women's Health Imperative. Am I missing anyone? Okay. All right, I don't want to miss anyone. There's a whole bunch of them. So, and you probably are members of some of them. NMA, yes, NMA is definitely a partner. NAACP, you know, people who are members, Urban League, National Action Network. So forth and so on. Again, they are on the back of that book. We have done a lot, and this is our 5th year. Hi, Congresswoman. Okay. We've done a lot in our 5 years. Please come, bring greetings. This is Congresswoman Maxine Waters, who has done amazing things when it comes to HIV. Come on, you want to say some words?
Trying to do 3 things.
I know, Your Honor. This is HIV.
Thank you very much.
Dr. Gail Wyatt from UCLA.
Good afternoon, everyone. Please forgive me for kind of breezing in here and breezing back out. I'm trying to work on 3 different workshops with panels on mandatory minimum sentencing, on some very important issues that are going on with Haiti, and President Aristide and President Martelly. And of course, I need to always pay attention to this issue. Let me just say this. Recently, I read something that you may have discussed today about the progress that's being made and how it is evident in every sector of our society except for African Americans and Hispanics. Did you all discuss that today?
We will. We will discuss it.
I beg your pardon? Oh, okay, you're about to discuss it. And so, my thoughts for today was for us to continue to ask ourselves why. Of course, we cannot deny that there's been progress in many different ways. But the fact of the matter is, we have fought the battles for more support for outreach and education, for more testing. We've had to fight about disparities in appropriations for the work that we need to have done. And we must continue to do that. But we must today commit ourselves to the proposition that we can take a bigger role in ensuring that not only we get the resources, and public policymakers must be the leaders on that, but that we can be creative enough to find a way to have the kind of communication and education that is going to cause us to see progress in getting rid of HIV/AIDS in our communities. I know many of you have been working for years on this issue, and I don't want you to give up. You got to work and work and work until we can get in the hearts and minds, particularly of young people, about HIV/AIDS. And so I just wanted to stop by today to let you know that no matter what the complications are in Washington, D.C., with dealing with the many issues that are confronting us, we cannot lose this issue as an important issue that should be on our agenda to deal with. I want to thank you for all that you do. I want to thank you for your participation. I hate to say it, because you've been hearing it for years. We have to continue to work and work very hard. Thank you very much.
All right, so thank you, Congresswoman. Again, we are here at the session Risky Crossroads, the intersection of sexual behavior and mental health. And I did talk about ALI, and I wanted to throw that over there. We have my favorite people, the Red Pump Project here, who is an organization that was started by two wonderful young ladies, and now they actually have a DC chapter, which is so exciting. They focus on bringing awareness about HIV and AIDS to girls and women, and they're going to be tweeting, and they're in the back, Brittany and Tiffany, and I wore my red pumps just for them today. And so those are the hashtags if you also want to tweet along. They're at Red, is it the Red Pump or Red Pump at Red Pump? At Red Pump Proj, P-R-O-G. And so with that, I'd like to introduce Dr. Perez. You had a question? Oh, I thought you had a question about tweeting. Okay.
Oh, no, I think you wanted to say Jay. You said P-R-J.
Oh, Jay, yes, thank you. G-J. Yeah. Thank you, Dr. Perez. So with that, I wanted to introduce our moderator for today, who is not only my colleague, but a very good friend. Her name is Dr. Marjorie Innocent, and she is the Vice President of Research and Programs at the Congressional Black Caucus Foundation. Welcome, Marjorie.
Thank you, Lisa. Good afternoon, everyone. I was actually prepared to stand for the entire time, and then Lisa said, it's a moderated discussion, you could actually sit. So it's up to you. Would you prefer I stand, or are you fine with me being seated? Sit? Oh, well, you heard her. I guess I'm sitting. I'm especially excited about this discussion that we are going to have today, and it's not just because we were able to identify and secure a fantastic audience of experts to actually lead us in this conversation, but it's actually a topic that Lisa and I have been talking about for some time. When I first joined the foundation and our work around HIV first started, I told her my background is in health and social policy, and in particular did a lot of work with adolescent reproductive and sexual health. And I told her, one of the things that we used to look at back in the day were some of the factors that impacted sexual behavior among young people, and we realized that not only in terms of how we defined those behaviors, but understood what were the underlying causes behind them, that there were a lot of limitations in how we were defining and how we were addressing them. And what we were seeing, in fact, was very often, not just for young people, but for adults as well, the continuation of those limitations then in how programs were being developed, frankly, how policies were being developed, and how people were understanding issues, if you will, as they were becoming sexual, people, right, living out their sexuality, if you will. It was quite a journey for us to get to this point, to be able to have this conversation. And yes, this work is absolutely focused on HIV and AIDS, but we were very committed to broadening up the conversation and talking about sexual health, okay? The other piece, of course, is that when we often talk about sexual health and sexuality, we often come to recognize, I know a number of you in the room, so I know I'm talking to an audience of people who are familiar with these issues, but I just want to state for the record that one of the critical components of people's sexuality, people's sexual beings, and quite frankly of their being in and of itself, is in fact their mental health, right? So we talk about people's overall health, we talk about sexual health like it's something completely separate, like it's this separate piece in people's beings. We talk about mental health sometimes as this whole other piece. And the nexus, not so much. Again, that manifests itself in a lot of what it is we're seeing or not seeing, right? So really, that's what we really wanted to have a conversation about, and especially because part of the effort that we're seeing more and more in our country is in fact an effort to be much more comprehensive, to be much more proactive in how it is we're defining and understanding health. When we're talking about sexual health in and of itself, when we're talking about mental health, what is that intersection? And what do we need to do better? And ultimately, really, to strengthen both what we're doing programmatically as well as we're doing through public policy to really be able to shift the needle from where we are right now. And so I'm very, very heartened also to see you all here. I know it's the second day of the conference. It's also the afternoon. Folks are kind of starting to shift gears a little bit and kind of starting to wind down. But I'm very, very excited to see you all here, willing to, be part of this conversation. So please know it's going to be just that. So I'm hoping everybody got a chance to pick up the bios that Lisa had put together. I think it's a one-sheeter, Lisa, or two-sheeter? It's a one-sheeter, yeah? Of all of the speakers' bios. So certainly hope you have them, but just very quickly, to my immediate left, to your right, is Dr. William Lawson, who's chair of the Department of Psychiatry and Behavioral Sciences at Howard University Hospital. Please welcome him. To his left is Ms. Terry Williams, who is a mental health activist and founder and president of Terry Williams Agency. Next to her is Dr. Gail Wyatt, who's a clinical psychologist, board-certified sex therapist, and professor of psychology and biobehavioral sciences at the Semel Institute for Neuroscience and Behavior at UCLA. And lastly, we have Dr. Warren Hewitt, who is HIV/AIDS counselor at SAMHSA. So to start off the conversation, I wanted to make sure, even though I know we're dealing here with an audience of folks who are very familiar with the topics, but I wanted to make sure that we were all on common ground in terms of how we were understanding and defining the key issues we're going to be talking about. So I'm going to ask each of the speakers to provide their own personal definitions of some of the key terms. But before that, I'm going to provide them with an opportunity to share very briefly some opening remarks and ask them why it is, from their perspective, this is such an important conversation. Basically, why are we all here today? Feel free to start, whoever would like to start first. We can certainly go down the line, but it's up to you.
Go ahead, Warren. By the way, I'm retired, so I'm not speaking on behalf of SAMHSA or the department. I'm speaking on behalf of me, myself, and I.
Okay.
I was looking at some data, and I wanted to start out with this because it struck me as so critical. This is gonorrhea rates in the year 2000 for the age group 15 to 19. And I'm going to use one state. I'm going to talk about the black belt in all of this because it's critical. 50% of our population is there. The rate for young women was 3,165.6 per 100,000. And for young men, it was 2,130.5. That's African Americans. Now, for whites in the same state, for young women, it was 211.8. And for young men, 57.3. Now, some years later, 2012, we're talking about 2,314.8 for young African American women and 1,104.7 for young African American men. And then same age bracket, 15 to 19, 178 for young white women and 63.9. That's the magnitude of the issue here. W.E.B. Du Bois talked about the talented 10th, and I would argue there's the talented 10th and the other talented 10th, and that embraces our population. We've got to be concerned about these young folks because that tells me that they're at sexual risk for HIV at some point in their lives. And in the case of the ones that I reported on in 2000, many of them are now HIV positive. Now, we got started talking about HIV in 1981 when the CDC talked about those cases of pneumocystis carinii pneumonia and Kaposi sarcoma in gay men in California, Los Angeles, San Francisco, and also in New York. At the same time, we started talking also about there being cases among injecting drug users. But what's little known in this is that there was a study done in '83 of 1981 cases of HIV in a New York inpatient hospital, and nearly 60% of those cases had at least one or more DSM-3 psychiatric diagnoses. We lost that fact over the epidemic, and what I argue here is the importance of making the connection between mental health, substance abuse, now behavioral health, sexual risk behaviors, and HIV. This is the compelling issue for our time. And it's a window through which we look at our community in a way that is constructive and engaging.
Sure.
We don't have to clap, we can just, you know.
We don't have to be nice.
No, this is a family thing, you know?
I'm delighted to be here this afternoon to give my 5 minutes. It's always a great opportunity to have your say, and I think that when we are together and we have an opportunity to have a dialogue, it's a great moment, a learning, teaching moment for all of us. And I want to convey to you why I'm so excited about being here. And that's because I've been studying sexuality and risk-taking for 40 years. I've been at UCLA for 40 years, one job. And I don't want you to clap, weep for me. And I want to tell you, all of that time, I have been trying my best to make the point that African Americans do not understand their history, do not understand the effects of slavery, and are not advocating for themselves in a way that will help us to achieve health and mental health. So this to me is like icing on a cake. If we have an opportunity to talk about what we need to be knowing and what we need to be demanding, not asking, but demanding, even in the face of HIV, the approaches, the money, the support, the advocacy is going in the direction of gay, middle-class, white men. Women are treated like boys or men. We do not have a comprehensive approach to understanding women's sexuality and all of the array of things that we have to be concerned about, including unintended pregnancy, and how we could allow over 30 years of funding to escape the needs that we have is just unconscionable. So I'm righteously indignatious this afternoon, and I want to lay out in this dialogue for you why I think this continues to be such a problem. We don't have good mental health in the African American community. We're still suffering from post-traumatic stress as a result of slavery. And to let anybody forget that and to think that they can just offer us what they're offering anybody else is on us. That's what I want in activism, and I want us to come out of this dialogue with an action plan.
You have one too, Tim. You have one.
You don't need it.
Good afternoon, everyone. I'm honored to be here. I was moved by what I've heard thus far, and I wanted to,
Be popular.
First, I did want to share with you that I wrote a book 5 years ago called Black Pain, It Just Looks Like We're Not Hurting. It came through my own suffering of depression. And what I know is that when you go through the fire and you come out on the other side, that's when you find out what it is that you're called to do. But I just felt that there was something that needed to be written to explain what our pain looks like, feels like, sounds like, and that so much of it comes from our unresolved pain, wounds, trauma, and scars of our childhood that we don't really pay, close attention to. And having said that, one thing that occurs to me right now is that we're kind of sort of speaking to the choir. All of us in this, right? Am I right? We're speaking to the choir, and what I want to really emphasize is that when we come to these gatherings, that if we could bring a young person with us, I mean, it's what we have to do. It's what we have to do. If they're not in the room with us to help make decisions or to help or hear something that they might not understand, So I would just encourage each one of you when you go out of here today is, I don't know, grab a young person somewhere, church somewhere, somebody that you don't even know on the street, in the barbershop, in the hair salon, and tell them about where you were today and why it's important to have this conversation. So that's my little, 2 cents there I wanted to say. And I also wanted to, because I'm very, very, very sleepy, so when I was on my, I'm just telling the truth. So I didn't know if the words would come out properly, so I've written something or, did this with it. So, okay, so as with major depression and other psychiatric illnesses and stigmatized illnesses like HIV and AIDS, there's often a feeling of isolation, disconnection, loneliness, helplessness, thank you, doom and or despair. These feelings in and of themselves impact a lot the relationships and intimacy. It's something that we really, really need to talk about. However, adding on to the risk of spreading HIV to someone that you care about, or finding or having or being with someone who's willing to the risk is another challenge that adds additional stress to having fulfilling and meaningful relationships. Something that we as human beings naturally crave and desire. But I think that that's what we have to really kind of focus on, what it's like for someone who has the disease and all of the stress and the anxiety that has. And so many of us meaning people of color, we don't go to talk to therapists. We think we take everything to the Lord in prayer, and I think we do that, but it also takes God puts the right psychiatrists or mental health professionals in our path. That's what I know. Go twice a month. And it's the gift that keeps on giving. So many times we don't really realize what the origin of what we do, what we say, how we move through our lives, that it comes from unresolved things from our childhood. So much of it. What was your experience? I was talking to someone the other day who had gone to a funeral where his cousin died by suicide. He had impregnated his own daughter. And the reason that apparently doctors can recognize incest, there are several abnormalities. Is that? Sometimes they can, anyway, they knew that this was, I told you I was sleepy. Incest, thank you. Oh, Lord have mercy. And so, long story short, this brother who was having sex with his daughter was on the phone with his mother, and he shot and killed himself. And so I'm saying that there are a lot of wounded souls out here, a lot of wounded souls, and we have to do what we can to just kind of meet people where they are, give them the opportunity to speak. There's another very pressing issue that I want to address, and actually I met this brother recently who I asked to come in. His name is Kevin Sherd over there. Raise your hand. His brother spent like 12 years in prison. And we were talking about just, what happens. These brothers are having sex with one another when they're in prison. If they didn't start out that way, they may end up being that way. And then they come out and sleep with women and don't use protection, and we don't insist on it. So it's an issue that we really, really do need to address. And that's kind of what I wanted to say at this point. I hope we can have a little bit of conversation about that. But I just think we need to be more aggressive, more assertive about this, because we're dying. I want you to say something at some point, Kevin. Okay, not now.
Good news about being the last speaker is that everyone said everything I wanted to say, and I just want to compliment them on an outstanding job. But all of these folks have been around for a long time involved in this issue. All this is new to me. I started out as an academic researcher, trying to figure out how the brain works and that sort of thing. And lately, I got involved in terms of this whole issue about AIDS. And got involved about a decade ago, said this is a problem, we've got some solutions for it. We looked at the issues of disparities, and I would like to look ahead 10 years and see that all of these problems are resolved. To my shock, I just thought about it, I said, my gosh, I looked at the statistics, they haven't changed very much. Some of the other groups are going down, the black folks are still sort of creeping up. In terms of not only HIV, but also recognition, treatment for mental disorders, and so forth. So it suggests that whatever we did didn't work very well. I'm sure there's some positive benefits in some ways, but it looks like we still have a formidable task before us. And I'm looking at this meeting, and I hope I can learn something in terms of how to do a reset, in terms of a different approach, because the others have not done what they're supposed to have done. And one of the things that I'd like to look at is the fact that when we look at what we're doing in terms of whether or not it's really getting the results that we want. And our system, huge sources and resources are going towards criminal justice system in terms of incarceration, treating these problems in terms of correctional system, and it didn't do any good in terms of the war on drugs. We also had a great plan. We were going to send out all mentally ill people back into the community and get them out of those hospitals, and then everything will be okay. That didn't work very well either. And what has happened is I like to look at this with creating what we call churning. Folks, as already mentioned, men having sex with men in the correctional system, folks that have severe mental illness involved in high-risk behavior. Well, I've looked at some data showing that folks with bipolar disorder have 10 times the risk. HIV is the general population. Many of these folks, especially in our communities, are not recognized as having mental disorders or substance abuse. The stigma of even recognizing it is so great that not because the treatment services aren't all around, folks never get there, because often we like to think it's better to be bad than mad. As a result, we have then a persisting problem that we really need to develop effective legislative as well as effective in social strategies to be able to address these issues. We say we don't have the money, we need more money. We got a lot of resources. One of the things our community has done has been developing resources. The resources are going to the wrong places. I like my friend James Jackson likes to emphasize the point that black folks, when we're under stress, we actually increase the amount of high-risk, unhealthy behavior. Eat more, drink more, have sex more, instead of doing just the opposite. And that we see the ability to do well, to get resources, as a time to have a license to just let it all hang out. Instead, I think we need to look at how we can use some of our systems that have been very effective, the church and others, to begin to create a positive environment and lifestyle that lead to better outcomes.
I thought you didn't have anything to say.
Not too much.
That's good.
So, can you all hear me okay? Okay, so keep that right there.
Thank you for bringing us together, by the way. Yeah.
I'll talk loudly.
No, she's recording.
So I'm gonna have to stand. See, told you.
You can have mine.
All right, so, here we go. If you all could indulge me for a minute and share your definition. It doesn't necessarily have to be a textbook definition, but based on your experience, based on your work, how you would define sexual health.
I can start.
Anyone? Sure. Go ahead, Dr. White.
I've written a lot about sexual health because I think that this is something that we as a community or a variety of communities really need to invest in. That's something we've never had. If you look in terms of where we had to come all these 400 years. So sexual health has to do with the knowledge and care of your body and those factors that affect its well-being. The knowledge and care of your body and those factors that affect its well-being. And a couple of years ago, I published a sexual health model, and I want to tell you about the 3 components of this model. They really, really work in terms of interventions and components of information that we need to convey to younger people. By age 10, children ought to know everything about sex. They can understand it. Female bodies can contain a male adult penis, unfortunately. It's much too soon, but that's what it is. And kids in our communities are engaging in inappropriate sexualized behavior or being exposed to inappropriate sexualized behavior because they don't really understand what it is that they're being introduced to. And I just think that's absolutely criminal because we're overlooking the importance of knowing everything about us. If we know how to make our hair look a certain way, we ought to know how to make our vagina smell a certain way. If we know that it's important to have an erect penis, then we ought to know how to keep it clean. And nobody ought to come and necessarily snip something off of it if you don't need it off, and you can hear my bias. I don't believe in a one-size-fits-all anything, okay? I just don't, because I've been studying sexuality all my life, and if we did it right, like most countries who have socialized medicine do, which is what we're getting ready to have, then we'd know that you teach people according to where they are in life and what they need to know. And then they retain it. You don't just teach them something and think, well, you're going to need it one day. No, you only listen to what you understand, what's relevant to you at the time. So, anyway, that's why I think this is important. Let me tell you about these three components. Number one is the factors around knowledge of the body, knowledge and care of the body. It has to do with interconnectedness. That's the ability to see yourself as a person, an individual unto yourself, but also knowing the connections that you have and the value of those connections to other people. And this is really where most African American, particularly women, have gone and gotten stuck. Valuing families, children, relationships to the extent that they are ready to die for them. Because we tend not to take care of ourselves, or we take care of ourselves last. Okay. But the value of interconnectedness is what has kept us alive for these 400 years. We were raised by other people who we couldn't even speak to because they spoke another language or dialect. We didn't know them, but we had that ability to be compassionate toward people we didn't know, and that was a source of survival, and it still is today. When I was growing up, we had kids from the neighborhood who'd come and live with us because they weren't getting along with their parents. Did you? And my mother and father fed them, and they went on to school, and then things would settle down at their house, and they'd go home. We just had people coming in and out because my parents were both teachers. So that's just what that was. If we did that today, you know how many fewer children would be in foster care? I digress. Anyway. All right. So interconnectedness is an important value that has cultural strength and sustainability. It's also a double-edged sword because in the service of connecting to people and maintaining relationships, many people value those over their own health and well-being. You can see that. Mm-hmm. The second is body awareness. This is just knowing how the body works. We should all know it. We should know it before our bodies start to change, and that's 8 or 9. For girls, we have to be sexperts. That means you know everything about what's happening to you, and you can tell somebody else. Nobody has a right, listen to me, nobody has a right to tell you what feels good, what you should be doing sexually, when you should be doing it, and with whom. You ought to know that, because your mother has taught you already when to cross the street, hasn't she? Didn't she tell you? You look for that red light, and you know you don't go anywhere. You just stand right there. Why don't we know that when our nipples get hard and our vaginas get wet? That's not the time to make a decision about who you're going to have sex with, or if a man's penis is erect. It's too late, isn't it? What's going to drive you from that point on? Nothing but the pleasure of it, right? Or the curiosity. You see, you ought to know when to stop. You don't ever let yourself get in that kind of situation, you see. And that's what I tell girls. If your nipple, you just brush your little hand over it. If you can feel a nipple, it's too late. Okay? Get up and go to the bathroom. These are common sense issues to cool yourself down. All right. All right. That's body awareness. The third is sexual ownership. This means you understand what's happened to you. It may be horrible, but you claim it. You name it and you claim it. If that was abusive, if it was coercive, you say what it is. Don't be afraid of it. It's not going to change just because you put a label on it. But what it's going to do is going to make you decide whether you want to do something about that or not. Don't call somebody who's 42 years old who's having sex with a 12-year-old boy a teacher of homosexuality or gay sex or a lover. That's an abusive man who's not even allowing a 12-year-old boy to make his own decisions about what he wants to do, all right? Just because it's a minister or a teacher doesn't make them any better than anybody else. We all have a right to identify who we are and what feels good and when. And if anybody wants you to give that up, you ought to be walking on out the door with your keys in the hand. I've written about that. So we have to be specific about sexual health. You see, it's decision-making just as much as it is knowledge. And this knowledge is ongoing. I'm amazed at how our bodies continue to change because we keep learning about them. Now we've got to learn about how the brain affects the body and how the brain is really the sexiest part of our body, for sure. Because we can literally, women can at least, I don't know. Women can be orgasmic and don't have to touch a soul. Well, you see, we ought to know this, right? Somebody's raising their hand ready to testify, all right? See, we ought to know this. There's no reason for women to walk around horny. We ought to know what to do. People will say, I got to have a man. No, you don't. Excuse me, you know? But you have to know how to do these things, and you have to give yourself permission to know. Why would God put all that knowledge out there for you not to have? Why is that good for somebody and not good enough for you? You see, don't use religion as the excuse. And everything God said was not in the Bible. He's talking to me right now. All right? So I don't know who you're listening to. But when it comes to sex, I know you all are never going to speak to me again in life, nor will I ever be invited to another CBC panel, so thank you very much. But you see, this is just basic information, right? Just basic information. And you ought to know it, and you ought to be glad that your children know more than you do, and they're constantly in dialogue with you. And you ought to be able to say to them, honey, I don't know. I never heard of that. Let's go talk to somebody and find out, both of us together. There's nothing you can ask me about sex or the body or something somebody proposed to you that I don't want to hear. So you got to give permission, you know, to tell me. You get in a situation, you don't know where you are, without any consequence, you call me. Do you know how many parents regret having told their children not to have sex or not to see somebody again, only to find out their children ran away, got abused, or got into some kind of sexual relationship much too soon with an awful person and would not come home because they thought that their parents would be angry with them and wouldn't accept them anymore. So you don't ever want to miss the connection between you and younger people. Nothing they can do would make you not want to go get them and bring them home. Nothing. Even if you got to get them out of jail, you just go get them out of jail. Because you know what's going to happen to them if they stay in there, right? We all ought to know that. That's an education that I got way when I was a little girl. You get arrested and we can't come get you, you know what's going to happen to you. They're going to get right between your legs because that's the place where they think they can take your soul away. And who doesn't need to know that? You see. So that's my definition.
I think this is Reverend Wyatt over here. Yes. I don't have squat to say after that.
Well, the thing is, Dr. Wyatt, you know, your definition was so on point, not just because you're such an expert, but because it touched on myriad other issues that we're going to be talking about, including the next one. So, definition of mental health. Now, this one I suspect will be of great interest to everybody here because even the concept of mental health in and of itself is one that is so often just the big black box from what I get from most people, quite frankly, who I talk to about this issue. So from you all's perspective, and whoever wants to talk about it, please go ahead and do so. How would you define mental health? And this includes both mental, sort of wellness, if you will, as well as mental dis-ease or illness.
Well, I think one of the key points is to recognize that we've put so much focus on mental illness. rather than on mental health. Mental health is not simply the absence of mental illness. And that is where, I think, and many times in our community, we get stuck on this issue because we look at folks and we said, you know, they're not crazy, they're not in mental hospital, they're all right. Well, they're not all right. Many times they have a lifestyle, a focus, a consideration of life that is very, very self-destructive. Not in terms of their making decisions, they're cognitively intact, not in terms of where they want to go in their life, but in terms of what they want to do in terms of their entire life package. I'm just dealing with so many folks who are homeless, who are unemployed, and I say, what happened? What's going on? I go through the DSM-5 diagnosis. They don't have any DSM-5 disorder. I said, what do you want to do? I don't know. What do you want to plan? I don't know, 40 and 50-year-old people. And I said, what in the world happened to you to make that point? And I think it ties in some of it with the whole issue of sexuality. Let's talk to one young man, and I just want to follow what Dr. White was saying. This guy was kicked out by his wife. I said, why did your wife kick you out? He said, I couldn't satisfy her. Is that the real reason? What kind of relationship did you have? How did you know her? Do you know what she likes? Do you know what she dislikes? Did she know you? Did you just happen to meet one day and there we hung out together and then that was my life? So part of it has to do with being able to maintain what some call self-actualization, know themselves, find out what's meaningful for life, and giving life meaning. All too often, especially when we see ourselves as a suffering people, abused people, oppressed people, we often look at mental health as the ability to get away from stressful situations, to just make sure that everything is okay. One of the things that's happening then, I'm beginning to appreciate, is what happens when you get past the 60, 65 and start retiring. You know, in the old days, we didn't retire, we didn't live long enough. And our whole public health system was built that. Now we are retiring. Now, or at least we're switching jobs to something that's you're not being paid for. And what happens to folks? We see that I've seen many folks just literally have no idea what are they going to do, even though they might have 10, 20, and we know that black folks get past 80, will live a little bit longer, 80 years old. What are they going to do for the rest of their life? And one thing that some folks do is they try to recapture their youth. And I think we've mentioned this issue several times. All too often in our community, we see 70, 80-year-old men with multiple young sex partners. And I don't have my colleague, Dr. Judge Burnett here. He always brags about his son invented Viagra. It was a tremendous invention. But it had a consequence that we have to, just like you got to be careful with a nuclear weapon, you also got to be careful with the social consequences of the agent. And the result has been that before we had these 70, 80-year-old guys sitting down and thinking, I don't know what they were thinking, but meditative thoughts, the state of the universe or whatever, trying to see how are we going to get that young girl. And often they have more resources, and these young girls are exploited, taken advantage of, and this is a contributor to HIV. I was looking at one of these statistics in the district where they're looking at who was getting HIV, and you think it didn't drop down when it got past 50. It stayed up. Another population of folks, the elderly who are becoming HIV infected, they didn't get it from drugs. Some of them got it because they still remain sexually active and they still look at the idea of sex as not only a sense of self-esteem, but as an important, as many of the young girls do it, a commodity, and the men look at it as, my gosh, I can do what I did when I was 16. Very difficult to tell them, well, no, that's not a good idea. Very difficult to say that's not a value. One of the, and then in terms of defining mental health, often we have to look at what do we look in terms of value as a society. One of the areas that I'm very much interested in bipolar disorder and the fact that it is grossly underdiagnosed in our community. And one of the reasons is that many of the behaviors associated with bipolar disorder are valued by our community. how many girlfriends you have? I see patients walking in and say, I got 10 girlfriends, same time. I have 20 boyfriends. And I saw one lady who was just calling, they were calling her literally day and night, and she thought it was a sense of self-esteem, but in fact, she was not mentally healthy. Significant mental disorder. And it goes along the line, buying sprees. Had a patient who went out there, he see a furniture store, he had to buy the furniture store. He literally was having large collections of rooms because he could not stop buying furniture, gambling, all the others, drug abuse. All of these are not signs of mental health, even though we treat them as if they're mental health. When someone, the big joke is if someone, mother died, you give them a fifth of scotch. Now you might give them a snort of cocaine or whatever. The idea is that somehow the altered state of consciousness is a source of mental health, rather than looking inward and beginning to share your feelings and thoughts to other people. So I think the key point is we may need to, in our community, redefine mental health. Not just the absence of mental disorders, but also looking at meaning in terms of where we are as a people and where we are as individuals to see how we can support each other.
We're also in denial about our mental health. How many people in this room have a family member or a good friend who suffers from a mental illness or a substance abuse disorder? We have to claim that in me and mine and you and yours. Otherwise, we lose those people like we've lost them over the years. I have a cousin who is lost to my family. Nobody knows where he is because the family was in denial about his mental illness. The other thing that's critical, I think, is you know, we've had this discussion, and we'll talk about it in an HIV context, but we've talked about the determinants of health and about how things drive, the context drives everything. One of the unfortunate things about the DSM is that it seems to ignore context. And I've seen a lot in the psychiatric epidemiology and research that's now talking about the environment, the neighborhood, the community, the factors that drive whether people feel good about themselves and their families and their neighbors or not. We need to understand this dynamic and how it functions in our community, because it's very clear to me that part of the nexus or the connection between HIV and sexual health and mental health is driven by this context that we have very little control over. One of the things that has come out of the work of James Jackson, David Williams, Tom Leviste at Hopkins is this question of residential segregation. And when we look at what residential segregation produces in the context of mental illness, it's especially profound. And then when you connect it to HIV, then you get people like Dr. Adamora, who's talking about sexual concurrency, sexual networks in constrained environments where you can't help but become infected because your network is limited to a residentially proscribed area. And this isn't just low-income communities. We have people from this area know Mitchellville. It's a residentially segregated community. The south side of Chicago is a residentially segregated community. And the resources that we need in order to address our mental health and our HIV risk don't exist. So in terms of this question of what is mental health, I think it's up to us to spend some time talking to our families, talking to each other, investigating what mental health means, what mental health and well-being means for us. Because not all of us are going to meet the test for clinical depression in the classic DSM-5 sense, but to be depressed, to have sub-threshold depression is something that a lot of African Americans probably have, but don't know that they have. And the other sort of critical thing, when I was doing my dissertation, which is on depression, I remember going and looking at the psychiatric epidemiology, and You know, one of the first studies was in the Midtown Manhattan study in New York, which didn't include us. This is in the 60s. And then the epidemiology catchment area study included us, but you know, some of the places had high samples, some had low. We have not routinely been in the epidemiology really until Dr. Jackson's work, where he looked at psychiatric disorders in an African American and Caribbean African population. But for the most part, people sort of ignore us and look at us in the general data and say, oh, well, they got low depression compared to whites, they got low bipolar compared to whites, and no one talks about what actually exists. We need to redouble our efforts to understand our mental health. And then finally, the Joint Commission on the Joint Commission on the Mental Health of Children in the 60s and President Carter's Commission on Mental Health, both commissions talked about the role of racism. We've had a number of researchers who talked about how racist behaviors and racist effects impact on the mental health and well-being of African Americans. We need to explore these issues and understand that post-slavery syndrome and its contemporary cousin and the racism we experience in our communities.
So, I just wanted some random thoughts that came to me. One has to do with, given the level of violence and trauma in our communities, it's everywhere we turn. And you might see somebody shot and killed or stabbed right in front of you, and you get up and you go to work or school the next day that you didn't just see that. And there are countless numbers of us who are witnessing that level of violence, and nobody's getting any help. And so it's just something to just really, really be mindful of. We look, and then when our kids go to school who are witnessing this violence all the time, they can't function in the classroom because of what they have witnessed, right? So they become disruptive. And once they become disruptive, then they get labeled with ADD, ADHD, when in fact they're suffering from PTSD. There's more PTSD in the streets of the United States than overseas in war zones. But we don't recognize it as a public health issue that really does need to be addressed. So I wanted to just mention that. And I also just wanted to, just because I want to move through it quickly, share with you just some signs that you might be depressed because you're always too busy. You never have or take the time to give yourself the care that you need. You're running from something. Something is eating at you. You keep things that bother you locked up inside, festering. You are afraid to express anything about disappointment, hurts, fears. You're afraid to express anger. You hold on to grudges for way too long. You can't ask people for what you need. You lie about everything, even simple things. You don't have the energy to do anything. You just have to force yourself to do everything. Can't seem to concentrate on any one thing. Look at the same piece of paper 5 times. Or you're steadily gaining weight. You know that because people give you that vibe. You might be cool to hang out with, and they love your energy, but you feel less than if you are not a certain kind. Many feel that way if you're not a certain size. You're not doing work that brings you joy. You're just working a gig and holding out for the check. You haven't been touched in months. Maybe it's been a minute since you got some. That's I'm going to say that. Just say that it's been a minute since you got some, and y'all know what I'm talking about, right? And then you start getting real irritable because you ain't had none. So I'm just saying, then they have toys, they have massages, whatever it is that you got to do. You sister, you the. I want to know your name. Monica, okay. Because she's been over there, the amen corner over there. Love your. You know that people are talking, you know this because their lips are moving, but you have no idea what they're saying. You're not even there. You used to care a lot about what you wore. Now you just wear anything that fits. You stay home a little too often. You call in sick. You feel like you're having a nervous breakdown. You say things like, I don't feel like it, go without me. You want a piece of this, MF? I don't care. I just want to die. I'm going to bust a cap in his ass. Shut up, bitch. When you hear those kinds of things, and you know what really pierces my spirit when I'm in the inner city and I see how some angry, tired, stressed out mothers yell at their babies. You just want to, so it's like it continues. She has no outlet. The kids get the brunt of it, and just this madness continues, and nobody's getting any help. So I just needed to just say that. I know we're kind of getting, but I just wanted to just kind of share those things because we have to pay attention. I didn't tell when I was suffering from severe depression, really had a breakdown. I would wake up every morning. I didn't want to face the morning. That's the first thing. So I would lie there in bed in the fetal position in tears. I didn't know what it was. And I mean, I'm supposed to know what this is. And I just knew that I didn't want to talk to people. It took every ounce of energy that I had to get up, to shower, to dress. It was very, 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 very difficult. And so we don't talk about these things. I would call my parents because I never told them. I would tell them that I was busy with work. I was traveling quite a bit. So that's why they didn't hear from me very often, because I didn't want to talk to anybody. So I'm just saying that the only way we're going to win this is if we share our stories with one another, because everybody in this room has one. And we have to take a layer of the mask off that we wear, because we're all wearing a mask. We have one for every different occasion. They're plastered on our faces. You all know what I'm talking about? Pretending to be fine and you're dying on the inside. So I just had to say that.
May I add one more?
Of course.
Okay. I think it's also important to realize that mental health is not static. In other words, once you reach it, you don't just stay there. There are times in your life where you dive. There are times in your life when you feel really terrific, things are going well, and we need to appreciate the fact that when you see changes in a person's behavior, changes in your own behavior, you have to recognize that you need to know what that is. And it could be that you need to go to a health professional and just have somebody, listen to your story, or some friend that you trust who's wise and objective to just tell you, am I the person you used to know 20 years ago? And really listen to what's changed about you, because you're identifying things that we should be aware of. But many times we're not aware. We're so busy. And I think people who are too busy actually are running, because they don't want to stop and listen and look at what's happening to them. We don't even understand it when children are depressed and don't want to go out and play and are bullied. And a lot of bullying goes on in the Black communities, in the urban communities, particularly around playing the dozens. We think that that's just something that kids do, and they talk about your mother and they insult you and what have you. And that's also a form of bullying. One thing is to protect a child so they know how to take a lot of abuse, verbal abuse and teasing, but another is to just put kids down every day. Where does a little Black boy get an opportunity to say, somebody is extracting my lunch money, mommy or daddy, and I have to give my money to them or they'll beat me up? When do we allow them to actually tell that story and not expect them to go out and beat that person up? I've seen so many Black fathers say, look, if you're a man, you go back and you kick that guy's you-know-what, and he'll stop asking you for money. But maybe the kid is not able to do that. When do we allow Black men to be boys, to need to be taken care of? When do we appreciate the fact that Black girls don't have usually sports? And when they begin puberty, it's around 8, 9, 10 years of age, and they're awkward looking. They don't know what to do with their hair. Many times they can't afford to get their hair done, as we call it, and nobody takes them aside to show them what to do with it. You don't have to go to the beauty shop, but you ought to know how to keep it clean and braid it and something pretty about it. How does a Black girl learn that she's beautiful? If she's constantly looking at television and the movies and the boys are calling her a bitch every day. We just don't realize that some kids can't take this every day. That it really wears them down. They become depressed. When a girl is 8 or 9 years old and she becomes obese, how is that okay? How is that okay? When you see that she can't find anything to wear, the kids are teasing her, and she may be getting ready to reach puberty, so she has what looks like breasts, but they're not really breasts, it's fat. Well, that's what breasts are anyway. But You know, what I'm saying is she has the look of an adult, and this is a kid who's overweight and doesn't know what to do about it. She's not eating because she likes soul food. She's eating because something's bothering her. We simply have to begin to realize that everybody doesn't have to go through the same thing with the same kind of inner strength. That sometimes they don't develop that until adulthood. But if we don't protect our children, then they can't grow into the strength that they need in order to cope better. And that we have to be able to say, I think you and I ought to go talk to somebody. We need to find out how I can help you. Put it on you. Don't put it on them. You're fat and they're talking about them. No, I want to learn how to help you better. Let's go talk to somebody together, and we're both going to learn it. Whatever they tell you, I'll do it too. So we do it together. It becomes a family issue. Don't buy potato chips and all kind of fattening food and expect one child not to eat it. That's not fair. If you see a depressed kid in the community, in your home, everybody has to be more mentally healthy. Make it a family issue, and it's not so hard for one child to bear.
So there's something very, very significant or two things I should say that are very significant in what all of you have mentioned here or have talked about and have elaborated on. The importance of context, right? So the realities of, the contextual situations that define the lives that we live, right? And the experiences that we have. The other part is when we're thinking both about mental health and sexual health, the importance or significance of thinking not just about preventing disease, but about wellness, right? So really health promotion and disease prevention. Not just a focus on the latter, but on the former. What does that mean for what providers need to do differently in terms of what they're doing now? What does it mean for individuals in terms of how they think about these issues and how they perhaps might need to reframe their thoughts, their understandings around mental health and sexual health and the intersection between the two?
One of the things that, one of the experiences I had when I was in medical school was that one of my supervisors came to me and said, you're black. I said, well, that's quite an observation. And they said, you're lucky because you don't have to worry about being depressed, which was another interesting observation. But of course, he had the point, by the way, when I retina you, you'll turn out to have schizophrenia. So one of the problems is that too many of our providers, and I thought, this is white folks, this is a white folk thing that we're dealing with. But then there's been studies, and we've done research showing that because we're trained in some of the same settings, we actually adopt many of these same kinds of beliefs, thoughts, and others, both in terms of seeing us from the eyes of a larger society that is actually, put it bluntly, quite racist. And one is that black men, wherever they are somehow threatening and violent. The old walking while black, I think Jesse Jackson said he gets scared when black folks walk up behind him. So that our young people, our young folks, take into context, go into a world in which they are thought of as dangerous just by existing, especially if they're big. And we've seen what happens in terms of Ferguson and dark others. Exactly. So part of it is that even among ourselves, we need to look at, as providers, look at these beliefs and systems in terms of especially young black men. What are their role in our society and what should they be doing? And how do you respond to their reacting to your fear and your complex feelings about where they are? And so many of our young black men, so many of whom are depressed, will then come across tough, strong as they can be. When they're dealing with young ladies, they tell themselves, well, if I'm going to be a real man, I have to seduce as many as I can, and I have to make sure I do it in a way that shows that I am indifferent to their personal feelings. So part of our role in terms of our providers, we have to give permission for young black men to be men in a positive sense. We have to provide a positive role model for them to do this, and we have to do it, and I think that in the long run, it pays off because we then allow them to develop a different way in which they can relate to society. Now, I was very disturbed recently when I was at a meeting, and I was told by our employment specialist, you know, we already determine whether or not we want to hire someone based on how they talk and how they believe. And they already decide there's one set of folks, talk tough, come in looking strong, and there's another set of folks who are quiet, meek, and non-assertive. And we will hire the quiet, meek, non-assertive person, even though that may not be the most effective way for the person to become successful in our life. I think we need to do more to begin to redefine what is it that's necessary for folks to be effective in our society, especially young black men, to do so without being threatening, but at the same time recognizing that unfortunately we live in a society in which the slightest effort by a black man to be assertive is looked at as a major threat in terms of the larger society. The other thing that I think is extremely important, and again, there's a lot of research showing that as providers, we don't like to listen. We listen, but we do not listen. And what we find is that many patients will come out and say, look, I'm not respected. I'm not appreciated. My values are not considered. And often we as providers feel that we're going to remodel this person in terms of our concept of what is, quote, mentally well. Well, we have to be very assertive to make sure that they adopt the values that we have. We need to listen more in terms of determining what is going on in terms of their mental health. Dr. Hewitt has already noted the research that's going on showing that there's not been very many studies in this country in terms of epidemiology looking at what is mental disorders. I was very impressed with some findings looking at people in China, finding that they had the lowest, one of the lowest depression rates in the world, and yet they had one of the highest suicide rates in the world. How does that be? And again, part of it also is that society is determined and made it clear. This is the way this is the face you present to the world. I think the same thing is happening in our community. In many ways, it's happening both in terms of how we're expressing ourselves, in terms of how we deal with stress, and how we deal with the kinds of ongoing racism and the kinds of ongoing issues that are involved in terms of our larger society. Many times we are the only ones who can be the spokespeople for the folks that we are working with. We cannot simply accept the role as being passive recipients of information, see if we can do a little psychotherapy, some medication, and have the folks turn, quote, normal. I've been in too many sessions where I looked at cognitive behavioral therapy sessions. I always ask the question, when we start saying, well, we got to change the person's irrational beliefs, so forth and so forth, what happens if the beliefs are not irrational? What happens is the world is out to get you. No matter what you do, you're going to be blocked at every turn. Well, you need to go to a different kind of therapy session because this is not really applicable to the folks that you're dealing with. And they always say something about, well, you got to treat them with assertive treatment and so forth. Wait a minute. This is the kind of therapy that we've been promoting as one of the most effective types of therapy. It's why my colleague of mine went to Uganda and developed a different type of therapy and found it was very, very effective in the personal therapy in the African American community because it began to recognize that our issues relate to relationships rather than that that the world, and in fact that the world is out to get you sometimes, and you have to develop effective strategies for dealing with it.
I just say those things?
Of course.
Yes. I just wanted to say, I do think that one of the hardest jobs in America is to be a black man. Not taking anything away from what women we as sisters have to deal with, but it's really difficult, especially when you've been born, bred, and raised to suck it up, to be a man, to not show emotion. I think it's something that we really should just kind of, keep in mind. And the other thing is, what I kept thinking over and over again is that there are no other people's children. that when we need to spend time, because we see that there's so many young people who are not being raised properly, to take them under our wing, to take them places where we go. We're going to someone's home for a dinner, or just wherever we might be going, just to spend some time with a young person and to share your challenges with them, because a lot of times we like to pretend like everything is all good, when in fact, kids are smart as a whip. If they live with us or work with us or go to school with us, they already know we're crazy. We can't hide that. You know what I'm saying? Kid says, Mommy, Daddy, are you sad? Are you angry? And what do? We say, oh no, Mommy's fine, Daddy's fine. And that right there is when we set our kids up for life, by not telling them the truth, because they know that you lied. And so I want to just, the adult wants to be protective of the young child, but that's really destroying that young person by not getting the actual truth. So I wanted to say that. And then also just, we have to keep in mind that our young brothers they don't have an easy way. They are building bigger and bigger prisons for our young brothers. They are absolutely, it's kind of like, hotels will not build a new hotel unless they know they have occupants. Do you all get what I'm saying? They are building these prisons just for our brothers.
Yeah.
And so we have to do what we can. You walk down the street, sometimes in certain communities, I might walk down the street, see a brother coming toward me, and I will smile. Brother turns around to look to see who I'm smiling at, because they know they don't matter. And we have to stop that. We have to walk. If you feel kind of crazy walking down the street smiling at somebody, just feel like, okay, that person didn't return it. Because I do that sometimes, and I'm really grumpy in the morning, but I make myself say good morning and smile to people. And it's just amazing what a difference it makes. Each one of us should share our own light with other people.
We followed Ferguson and all the events that are still unfolding there. And some years ago, a colleague and I were talking about trying to reconstruct, these intentional legal intervention homicides to determine whether there was actually suicide and not clearly legal intervention as in a offender being shot by a police officer. And I recall from not from Ferguson, but from St. Louis, about a week or 2 weeks after Michael Brown was killed, that there was another African-American man killed, and he said to the police officer, "Kill me." And I don't know the genesis behind that, but I think one of the things we need to understand about what's going on in our community is this state of mind that a lot of our young brothers are living with. And the other thing is, somebody mentioned about post-traumatic stress, and you can't, like I grew up in Los Angeles, and in 1968, 9, I got shot in South Central Los Angeles. And I don't know that I had post-traumatic stress because I couldn't characterize it at the time. But as I recall my experience, I still have the black man's fear of having your back to the door. But for me, it's a very irrational fear. And I know from the times that we spent in Los Angeles after that, after the riots in 92, that a lot of the people that we interviewed on South Central Los Angeles felt a fear that they couldn't characterize. A fear that was so extreme that a car backfiring and they'd fall to the ground. And these young people and not so young people had to go on with their lives, and we need to understand what kind of support we need to give them and give their children and their children's children in dealing with the traumatic stress that's associated with the violence that we've seen erupt in communities around the country, not the least of which is that perpetrated by law enforcement. And being from LA, the LAPD were notorious for us. And then the other thing that strikes me is that we have to, in this society, in this day and age, instruct our young black men as to how to behave, how to assume the role. I can remember my father, who was from Tampa, Florida, that he had an affect about him where his eyes were lowered, his tone of voice was lowered, and he was very deferential because he had to deal with white folks in Tampa, Florida during segregation. And it's almost as if we are returning to that in terms of how we need to instruct our children in order to protect them from people who are supposed to serve and care and protect them. And that's scary. The other thing is that I think this whole notion of conversation is so critical. I know with my own children, my daughter suffered from depression. I think my granddaughter suffers from depression. We need to have ongoing conversations and be free and honest about what's going on with each other. And that, we were up in New York this weekend for Ruby Dee's memorial. And afterwards, we went over to the house and we had dinner as a family. And I thought that was the most wonderful experience because I was a stranger. I'm not part of the family, but I sat down with people who I consider now to be friends and family. We need that. We missed the family meal. We missed the family discussion, the intimacy and the touching of love, the spirits that come together. It's that soft but most significant stuff, I think, that is the glue and the very foundation of moving beyond mental health challenges or preserving the mental health of a family.
And folks, let me just mention really quickly, we are going to move into a question and answer period. We definitely want to make sure that we provide that opportunity to you. So if you want to start moving up to the microphone, please feel free to do that. Go ahead, Dr. Wyatt.
I want to make the connection between what happens when psychologically people are overwhelmed, they feel helpless, they feel disconnected, which often happens when individuals don't talk about their feelings. And that is they many times use sex as a release, as a way of making themselves feel better, making themselves feel powerful. And that's what we call a power imbalanced relationship, where one person is usually manipulating the other one to get them to do what they feel they need to do, or perhaps what's not being done from them in other walks of their life.
And it's cheap entertainment, too. Sex is cheap entertainment.
It feels good and it's cheap entertainment, absolutely. And this is where the risks come in, because many times these are not relationships because people don't know each other. There's an increasing tendency for kids to use sex as a way to get to know each other, instead of the other way around, where you get to know someone and then you decide that you want to have a relationship with more intimacy that moves to sex. But it's actually occurring much too soon in early relationships, where kids really have no idea about, first of all, the status of their partners. And that's why it's so important for us to teach kids within the realm of HIV, and that if they make that decision that this is somebody they want to be sexually active with, it usually comes after they get to know the person as a friend, that this is someone they spent time with, they realize they have things in common. In other words, you're teaching them how to develop relationships. And many people think you should know that, but where do you learn that? People have to teach you. And one of the things I tell young men and women is how to find out if the person is someone who's trustworthy. If you can't trust the person, you don't need to be with them. And I always recommend that they give them money, something that you really don't want to lose, like $25, $30. Ask them to just keep it for you. And don't ask them about it. Let a month or so go by. And then ask them for their money, your money. If they don't have your money, there's something wrong there, you see. And what you want to do is to test people. Test the relationship. You know, you tell them things that you really will tell them, I don't want you to share this with anybody. And maybe it's something that you haven't shared with anybody else. So if you hear it, in other words, you're going to see whether they really can keep secrets. If they don't come on time and they don't call, that within itself says something to me. This person doesn't respect you. They don't value you. Okay. If they don't know how to speak to other people in your family, to address them properly, that says a lot. A lot of people don't have families, so they don't know it's important to speak to your mother or your father. You know, we really have to teach kids. Then, if the relationship develops, the sexual part comes in, and that is not something that you do without talking about it like a business transaction. And it isn't done while naked. It's done with your clothes on. Because you may hear something that you don't like, and you ask them, where do you see this relationship going? This is the hardest question that I have trouble teaching women. Because the answer could be, I don't see it going anywhere. And then the person's gone. Right. All right. So where do you see this relationship going is asked in order to prepare yourself for it's going to sex. It's something I want to work with you to let's get to the sex part, all right? Or it's not, I'm just here to have fun and have a good time. Well, that tells you a lot. If you decide that you think that's a viable relationship, okay, but it's not because the person's already told you they're not making a commitment to you. And you'd be surprised how many people don't use any form of protection even when their partners have told them that they have no future. This is not a relationship. They have other partners. And the mentality often is, when he's with me or when she's with me, doesn't really matter which gender, they're mine. And I'm really not concerned about what goes on when they're not with me. I can't control this person. Well, that's a person who probably has multiple partners, right? And they're telling you that. Now, people slip and slide, but these people are actually telling you. And people still don't pay attention to it. What is the underlying issue here? It's the fear of being alone. And that psychologically for Black people is poison.
And, yeah.
Yes. But you've got to know that that psychologically was one of the reasons that drove people into depression, and it drove people into a mental state that you really can't control because we were alone. And we see people in our neighborhoods and families that are alone, who have nobody to talk to. Nobody's marrying them. Nobody goes out with them. They don't have any friends. The only friends they have are people at church. You've got to realize that we have to teach people that you are not born in this world to be matched up to anybody. That you are born alone and you will die alone, and you have to be your own best friend. If somebody doesn't want to meet your criteria for sexual activity, then pass them on and wish them the best. And that may mean that you go on being horny for 10 months, 2 weeks, 2 years. That is the price we pay for survival today. And these things have to be taught. Everything is get it in a minute, right? We have to teach people that relationships don't happen, and if they do, they're wonderful while they last. But there is not a partner for everybody. See, these are new concepts, and we especially have to teach girls that. Because when you grow up and people are constantly asking you, where is your boyfriend? When are you getting married? When are you going to have children? There is a pressure on you to perform, at least in that arena. And we really want people to develop more carefully constructed relationships that are realistic and that have the kind of planning for contraception and HIV prevention built into them from the very beginning.
Well, perhaps I'm being, and you'll forgive me for a moment, perhaps I'm being presumptuous, but speaking of young people, we're talking about wanting to have young people be part of this conversation. See three lovely young people here
Young people
who are waiting for their chance. I want to make sure we give them a chance
Yes.
to share their thoughts, questions with us.
Hi, everybody. My name is Kaya Alote. I'm currently a junior marketing major from Howard University.
Welcome.
And, yeah, I really appreciate this conversation. So many times this is not had, and I'm somebody who's been advocating for mental health in school since high school. I try to bring it on campus at Howard, but it's hard a lot of times to get people to jump on and kind of join the movement with me because there's a lot of taboo on the subject, and I just wanted some advice from the panelists. Oftentimes there's usually just like one event, and in that event there's only like a couple topics to cover. So on campus, if I was to have an event, like what's just one or a few messages that would really resonate with the audience and something that would prolong long-term conversation about mental health.
First of all, I hope you have a chance. I'm sorry that she had to leave. Donna Barnes has been very active in terms of promoting on campus, having folks talk about the risk of depression and suicide. Also, Mental Health America group, which I'm the DC chapter president, we're now reaching out to the Student Counseling Service. And we also have a medical student interest group that's interested in mental health, and they're doing outreach. I'm going to talk to them about seeing if we can reach out more to undergraduate students, because that certainly needs to be done.
And
The School of Social Work.
And the School of Social Work,
School of
exactly, has a
Social Work,
group,
and-
right.
also, I just wanted I lost what I was going to say. The person that Bill referred to, Donna Barnes, she started an organization called NOPCAS, N-O-P-C-A-S. I'm going to go get my notes. I'll give it to you afterwards if you like, but it's an organization for, her son died by suicide, and so she started this organization as people of color against suicide, but I'll give you her information. The other thing is, whatever the most pressing issues are, take a small group of people, what are the most pressing issues that people are dealing with? And then build your session around that, because sometimes people are just really hesitant. Everybody has the same kind of questions, but nobody wants to be the first one to put their stuff out there. But when one person has the courage to do it, the floodgates will freaking open. So I applaud you, and you should go ahead. I want to hear what you're doing in a month from now, okay? I'm going to give you my information. All right.
And I also want to note that what you're recognizing and what we've now recognized is that mental problems occur on campus. We sort of ignored it in the past, but what we're now recognizing is that around the country, we're finding that there are students who have a whole host of problems. One of the problems that I'd like to emphasize is the whole issue of synthetic marijuana, which is leading our students to end up, some of them, dead, crazy, whatever. Crazy is not exactly a technologically superior name, but that's what happens. End up hospitalized. They think they're having regular marijuana, and I won't get into the whole issue of legalization versus decriminalization of marijuana, but it does reflect the fact that folks are using these kinds of drugs to deal with the stress of campus life, and the consequences sometimes are not very positive at all. And also, unfortunately, many faculty and teachers are simply very uncomfortable in dealing with these issues. Get out of my classroom is often the response. We have a counseling service, but again, as in many, it's just in terms of the amount of resources, in terms of what's needed, it's just touching the basic elements of what needs to be done. And there's now out there the National Depression Group based at U of Michigan has been now pushing campus activities, and NAMI now has a National Alliance for Mentally Ill now has a campus chapter, but our HBCUs are just getting into the story. They really need to do a lot more. I have to applaud Dr. Satcher, who's working closely with Morehouse to begin to address these issues. But again, the bottom line is just because folks are in school, they've college, they've made it, got successful careers and so forth, doesn't mean they're not away from a huge amount of stress that goes along with campus life. I'm not even getting to the whole issue in terms of sexuality on campus, where there's a lot of tremendous pressures put upon young women on campus in terms of being able to determine is it okay to have sex with this guy's big man on campus, should I do it? And the young men on campus, some of whom are incredibly shy and withdrawn, and who have no idea how to appropriately relate to a young person, or the athletes on campus who may have all kinds of opportunities thrown at them, and they have to decide how they're going to relate to people.
Yes, ma'am.
Hello.
Hello.
I know I've been in the amen corner, huh? You guys can talk to me all day, though, because I swear you opened the church for me. I don't know. I mean, it's so many things I can ask and say, but I guess my main question is, I feel like this session is a conference, in a sense, and how do we take a conversation like this out of here to have us advocate about it more. Because I think the problem, as I see in my personal life, is mental health is shunned and sexual health and wellness education is shunned. So it's like, how do we get that comprehensive sex education in that gradual step? Because I make a conscious decision. I don't have kids, but I have nieces. I make a conscious decision when my nieces were 3 and 4, when they were washing their bodies, and I had to watch them to say, did you wash your vulva? Teach them the proper terminology for their bodies, because I didn't want them to have an improper body image. So how do we take it out of here? Because I'm the person who now, because I'm the political person and a person who loves to advocate for sexual and reproductive health, I'm in these conferences or in these women groups that talk about sexual and reproductive health, that talk about mental health, but I'm the black face, and it makes me angry. I mean, I've gone to conferences there's a conference called Catalyst Con, there's a sex ed conference from the Center of Life and Family Education in New Jersey that I attend. There's Woodhull that's here every year in August or September. There's sex ed conferences in LA that I have to fly to just to get the knowledge to come back and talk to my friends. I have a friend who has an adult novelty store. One thing we do together is we try to go to these conferences and teach the people that come. We have one where we ask the parents to bring their teenagers, and we talk to them about sexual health, but having safe pleasure, which is something I've learned from Megan Andu from the Center of Sexual Health and Pleasure. And I want to know how we get this out of this context and into a bigger form, so that I'm not the only black face at these conferences trying to learn, and I don't have maybe the proper credentials to teach for people to listen to me, but they need to hear what I'm learning.
You're a very powerful spirit.
Thank
you really are. So you can organize something. That's all I'm saying. You can organize something. You could be at the local church. It could be just grab some of your colleagues and just say, this is what I want to do. And talk to them honestly about your own sexual experiences earlier. You don't have to say this is what I do now, but you can, you know what I'm saying?
I totally get you, I understand.
I'm just saying, but that's
Yes.
the only way that you're going to get people to come together is if somebody raises their hand and speaks is the first person to say something. Watch the floodgates open, for real. But you're a very powerful spirit.
Thank you.
And along with that, and sir, I'm going to let you speak in 1 second, ask you all speakers to give some thought to this. Of course, I'd be remiss, given where we are, what event we are attending, and who I work for, not to talk about how public policy can and should be used to advance exactly what this young lady was talking about, and what you all have been talking about as well. But so keep that in the back of your mind. Sir, please.
How you doing? I have my name's Kevin Sherrod. I'm the author of this book, Lessons of Redemption. I'm also a drug prevention specialist, but I also spent 12 years in prisons across the United States for drug trafficking. So I'm a casualty of the drug war. And being released from prison after 12 years, I didn't understand that I was dealing with mental health issues myself. And so after years of even writing this book or studying mental health, I'm of the mindset that no man should be released from prison without counseling support because of the trauma of the things that he's witnessed in prison, or just the fact of just incarceration itself. Incarceration has an effect on the mind that people just don't understand. And so with the large numbers of black men coming back to the community, right, with these issues, and it's not a surprise that the recidivism rate is what it is, right? It's not shocking, right, when men have experienced trauma in prison and have seen a lot of ugly stuff. But even prior to that, their lives on the street wasn't great as well, right? So they had many years of just ugly stuff, and then they bring these things back into the community. So I'm just of the mindset that mental health for incarcerated men has to be something that has to be discussed. With the bravado that men feel they have to portray, especially black men, that talking about mental health is a difficult conversation to have. And so I remember myself even writing this book in 2008. I remember sitting on the couch in the living room in front of the laptop writing. And I started writing about these prison stories and things that I saw in prison and ugly stuff that I witnessed in the streets. And a tear came out of my eyes. Now, mind you, I'm still this black male that don't understand that crime might be okay. Like, that's not necessarily a bad thing, right? So when that happened, I was like, wow, I'm going crazy, I'm losing it, what's going on? But as I studied substance abuse prevention, the work that I do now, and as I studied mental health as it relates to substance abuse prevention, substance abuse, then I said, oh, well, I was dealing with post-traumatic stress myself, not even understanding it. So if that's the case for myself, there are many men that are being released back in the community, dealing with this undiagnosed issue. And trust me, it's causing them issues with relationships, causing them issues with employment, causing them society issues at all across the board. And so my comment, the comment I wanted to make is this: when is mental health for men being released from prison going to become a priority for not just for our country or community, for this country, because of the large numbers of black men that are going to prison and being released back into the streets. And that was my statement. Thank you.
And obviously, and I know we'll talk about this, but and thank you so much, Kevin, for your comment. It clearly speaks also to, very much as all the speakers have talked about already, the larger issue of how black people are dealt with in our country, right? But in particular, black men. So it starts from the beginning and it just continues on. So obviously we have an immediate crisis with the pipeline. We have an immediate crisis with folks who are coming out who might be cycling back. But then there's this larger issue of, the folks who are literally just coming out, right? I'm talking about just being born, just, starting to hit 7, 8, 9, right when they're about to become a threat. How is it that we're actually dealing with any challenges that they may be facing? How is it that, as a society, we're actually already starting to accept those normative definitions of what it is they actually are going to become before they have actually even manifested anything that would suggest that they're about to become a problem, right? So again, I think about, what it is that happens, from a practice standpoint, but then also, and that could just be not just obviously medical, providers, but this is teachers, this is, police force, this is et cetera, right? And then of course what happens in the household. And then of course, then you tap onto that once people, actually start to become of age and become older. How is it that we're actually going to continue this and be comfortable as a society, as communities, to just see this progression happen before we say halt, right? So I want us to give that some thought, and we'll talk about that. And I'm very happy that you asked the question about recommendations, if you will, for engagement, for action, because that's actually something that we had agreed to as a group, to have the panelists share, okay, in terms of strategies for people to become more civically engaged around this issue as well, or these issues as well. Yes, sir.
Good evening, everybody. My name is James, and I'm an educator from Memphis, Tennessee. And before I ask my question, I want to say thank you to each of you for sharing your expertise and knowledge on this issue. I'm not even going to lie, as a young person, I think the stigma, as you guys have mentioned, is so strong that I didn't even want to come to this session. But I still, you know what, I need to go because I will learn something, and I'm glad that I have. As an educator, I serve students who are in some pretty troubling communities, and they have a lot of challenges. And mental health is one of those things. I mean, a lot of them are in poverty. They come to school hungry. A lot of them are taking care of themselves. Their brothers and sisters walking almost 2 miles to school. Just a lot of different things, as you would imagine, in an area that doesn't have a lot of resources, jobs, and opportunities. So as an educator, I just wanted some advice and or resources around like what I can do to serve my students, because a lot of the times I feel like I'm having to be teacher, I'm having to be dad, I'm having to be your friend that you want to talk to about something, I'm having to be all these things. And sometimes it can take a lot of your energy away. And I know I love my job, but I want to be as effective as I can be to the students. But I'm trying to find ways to where I can, number one, have balance, and number two, find a way to, just integrate some of this knowledge that you guys have talked about today in the class. I can be more effective as a teacher and as a leader in my community.
Can I just ask you, what grade?
Ooh, 6th grade, right in the middle.
Right, yeah, right at that point. Yeah.
Are there social workers at all in the school?
To be honest, there are,
they're
but
not.
they do so many other things, they don't even have time to do the job.
Because one
to
of
be
the things
honest.
I was going to just suggest is, and maybe to not have it get too deep, but to have there's a guy that I talked to recently who's a teacher who starts out his morning with his students with something that you needed to share, something that may have happened that morning that might have upset the person, so that people understand that they're not alone in their feeling. And dare I say, when an adult has the wherewithal, the strength, the courage to share one of their own experiences, I think that levels the playing field, because again, adults always want to feel like they're the perfect ones. But if my teacher is saying he's had a difficult time and this is how he kind of worked it out, I think that's a real blessing, and adults need to share themselves with young people as well. So you might want to just think about that, because then one person will say something and then somebody else will say, well, yeah, well, this happened to me.
The other thing you do is, thank goodness that we're now developing some resources. I was just talking to James Comer, who Comer School has been around for a long time, making the same point, and that is we provide nurses for every school nurses, but we don't provide a mental health provider to deal with these kinds of issues. Or if we do, might send a kid who's got tearing up the classroom, but you don't really have anybody to come there to talk to. So your concern is reasonable. It makes a lot of sense, and you should have the resources there to deal with it. Hillary Clinton tried to do it in Arkansas, and they stripped the funding from a program when she tried to do it. So part of it is to see if we can get the community recognizing we need something addition to the school nurse to be able to be available for our kids. So I suggest, if you can, Comer is willing to come out and talk. Wade Barkins at Howard is reaching out to the community, working with schools to provide them with the kinds of skills and support to deal with these concerns. And there's, in terms of policy, the Affordable Care Act, there's opportunities to develop more school-based mental health programs, and there's several bills that I understand are moving forward to try to address this concern. I think you're absolutely right. You're right at the age group. Most, something like 60–70% of mental disorders begin right at that age group that you're at. And also that's the time when the kids start really getting into drugs. And that's where we can make interventions to be able to prevent problems further down the road. So don't give up, keep hanging in there. We can see that help is on the way.
Thank you.
I would also, since it's a little ways, but I'd reach out to Meharry, to their Department of Psychiatry.
Okay.
And the other thing, you might just form your own group, an after-school group, and just to begin a conversation, and then try to identify a social worker or somebody to participate with that group. And I think you'll find you'll get a lot of support from some of the students.
Exactly.
Of course, I had one question, and I'm still going to ask that one, but since this is a panel I put together, I'm going to ask two. First, I'll just share a story, because everybody talks about children, but literally this week, my 7-year-old second grader told me about a little boy. My son just got a haircut, and he was like, Francis told me that my haircut was ugly. He's like, I thought that was mean. And I was like, well, you know, people have bad days, you know, whatever. He's like, yeah, well, that sent him to the office, because that was his 5th offense, you know, basically, at school. And I was like, wow, well, remember, maybe something's going on with Francis. He was like, well, he did say his dad died. He's 2nd grade, and his mom's in the hospital, and his grandmother has to take care of him. And I was like, well, how do you think that would make him feel? And my son's 7, he starts like crying. He's just like, I think that would make him feel really bad, and like, because he misses, and he keeps a picture of his parents in his desk, and every time he pulls it out, it was like the saddest story. He's like, and it's black and white, and he described how they were standing, and he was like, he gets really upset and starts crying every time he looks at this picture. Wow. And I'm like, oh my God, like, this is like so awful. And so when we were going to bed, we said some prayers for Francis. And my son said him, so he prayed for his father that he was okay in heaven and that his mother would get out of the hospital. And the next day, he told me that Francis was really nice to him. And he told Francis, he said, me and my mom prayed for you and your mom. And the little boy was like, thank you. And so for the last 2 days, Francis has been really happy, and mom has come home from the hospital. But I just felt like, wow, that is some heavy stuff for a second grader. And like here he, after a couple times of getting, I guess redirected, they made him go to the office. And so I was like, wow, that's how people can get, as I heard everybody talking, how young people can kind of get put in a box. When here he was having a really bad, kind of time. So that was the story I wanted to share because it really, the second is I wear a lot of hats. I am a consultant for the Congressional Black Caucus Foundation. I have also founded an organization called Industry Ears, which has been around for over 10 years, that focuses on the impact media has on communities of color and children. And one of the things, I've testified in front of Congress, I've gone up to Harvard and talked to Dr. Poussant's group, and I really just have this thing that I say is happening, but I can't find any research, and nobody's doing any research, and it's particularly around music. My background's in the music industry. So I can pull out all these examples of music videos that have, the music video has like an 8-year-old in it, and it's talking about getting head. We could talk about the music that's on the radio, and it's very sexually explicit stuff. And what is the impact on the mentality of the folks that are hearing this music? A friend of mine did a book, Why White Kids Love Hip Hop, and in his research, he was going around the country asking women, how they felt about being called, a bitch in the music, particularly white women. Like, how do you feel when you hear that? Oh, we don't feel anything. They're talking about black women.
That's right.
Wow. Yeah. And so I'm like, wow. But we internalize that too, that they're talking about black women. And so, I talk to people that are around young people, and the way that young girls are mimicking what they see in videos, kissing other girls, trying to make out so boys don't see them. And so I'm like, we talk about the high rates of HIV, but yet every video is about have sex, with multiple partners, or do some Molly, or, to do drugs and just, so it's like this contradiction that we have. And so I always ask, well, where is the research on the impact music is having on my children and in my community? And there is none. Everybody wants to do it around violence and video games and all of that, but not music.
There are several studies that have documented that girls' behavior is influenced by the music that they listen to, and that it propels them into early sexual activity. So yeah, it has been documented.
Oh, that's the Gina Wingood study.
No, it's not Gina. I'm sorry, I don't remember, but I've got it. If you want to email me, I can send it to you. But I think the issue for me is there's always going to be some kind of noise and garbage about black people. Why do we listen to it? Why do we allow it to be played in our homes? And if we are listening to it, why don't we sit there with our kids and explain exactly what all that means? Because many of them are saying the words, but they don't really understand what it is they're suggesting. I remember some kids, I had a course, were showing me about the music videos, and they had the one by, is it M. Kelly, where he slides the credit card down between
Nelly.
R. Kelly. Nelly.
Was it Nelly?
Yeah, sorry. It's Nelly. I was just blown away that somebody would actually, film something like that. And some of the women I understood were from Spelman.
No, the Spelman women actually protested against the video and didn't want him to come to the campus when he wanted to do I think it was leukemia blood drive for his sister. And they were like, oh, you can come, but first you need to sit down with the women and have this conversation. He refused to have the conversation, then blamed them because they wouldn't do the blood donation. But no, the Spelman girls were the ones that were very active in pointing out that was a wrong.
But can I okay. I think what I'm trying to say is that we're not teaching our kids to be advocates and to realize that the music that they're listening to has a lot to do with how they feel about themselves, has a lot to do with their people. And I don't know many groups that allow the kind of negativity that we allow in our community and don't do anything about it. We just almost accept it like an oppressed group.
If
Well,
I could
my
add something in
organization-
here, though, because I recall having heard this, when I was actually living in Baltimore, I went to grad school up there, and it was a story that a friend had shared of a party that she had attended. And there was a pretty young girl, chunky. She was very quiet. She was a little young. She was like 5. And she was just, kind of sitting by herself, whatever. The song came out, I think it might have been Drop It Like It's Hot. Literally, she got up. And she starts dancing. And people were kind of like, okay, because she really started to get down. And her mom was like, go ahead, girl, drop it like it's hot. Mm-hmm. So, and literally, she was on the ground. Mm-hmm. So literally, there's a part, part of your comment is so well taken, but we also have to understand that the very people who should be protecting our kids are themselves throwing them out there, whether they recognize it or not.
They know it's about the bottom line. That's all that drives every single thing, everything. And for as long as people will go out and buy it, that's what's going to continue to sell. I grew up on this phrase, all that's required for the triumph of evil is that good men remain silent and do nothing.
Well, I just want to add, just so you understand, so my organization does look at the policy. There is a policy that the FCC has that says sexually explicit content cannot be aired between the hours of 6 a.m. and 10 p.m. The problem is if you don't complain, it ain't a problem. And so that's kind of where I've been, but I'm really sick of chasing content. I've gotten enough TV shows off the air with 21 baby mamas and all of that other stuff and, pushing the stuff in the background. I'm done. And so it's all about, to me, is empowering young people because we can't go around and talk about every song because these are public airwaves. They're on everywhere. It's something that we cannot control in that sense. And when the FCC and licensing has changed, everything is just free willy. Everybody can own 20 stations. And so it's really about, to me, educating and becoming more critically aware, understanding what people are trying to do to you. Like, this is really about racism, quite frankly, because the people who greenlight this music don't look like me. Right. The people at the top with the money, and I don't blame the artist, I blame the broadcaster, because quite frankly, if they play Debbie Does Dallas on NBC, are you going to blame Debbie? So you can't blame the artists, it's the people who have the control to put the things in. It's not consumers.
Yeah,
No, but they don't
I do
have to
blame
play
the
it.
artist. I do blame the artist. And
You can't blame the
I
artist.
don't think that they're just naive.
Because they don't have to play it. There's so many other ways and avenues.
Okay, but where does change begin? It begins with each one of
Then
us.
the artist, then the record company, as somebody who worked for Capitol Records, I'm telling you, and worked for Infinity Broadcasting, CBS Radio, I'm telling you, okay, so they make the music, they just don't play the music that we would want to hear. And so if they want to do Yin Yang Twins or whatever, they can do that. Quite frankly, the law just says they should play it after 10 o'clock when children are most likely not to listen. But we're not getting that in our community. And I've confronted many, but it's hard to get people to do their due diligence. You've got to complain. You can't sit in this room and complain. You have to write a letter and make a phone call.
But you also got to recognize there's a problem. And
Yes.
and I think the point is that you can change, you have to artist everyone else. It's the
Right.
community that's going to have to recognize there's a problem. There was a whole issue of Journal of Black Psychologists who addressed this issue. Colleague of mine, Robert Phillips, who recently passed, who's written quite a bit about this. There's also several people in the Department of Social Work at Howard who've written about this. And the issue is not simply that folks that we're presenting women as being exploited, it also is dehumanizing to the men as well, because it
Yes.
makes them, and there's multiple studies showing that they're more indifferent to women, see them as commodities rather than as someone to be loved and cared for. But at the same time, we have to look at why is it that the community accepts the music. Because one of the when it's been criticized, it's like other kinds of media that we have. One of the findings was that some women accept it because when you criticize the music, they felt they were criticizing black people. So I think we really have to look at the attitudes, underlying attitudes behind the acceptance of the music if we're going to make a real difference in terms of doing it. You're not going to get much action in terms of protesting if people go out and say, you know, you shut them down, but let's bring in somebody else who's going to do the same thing. You really have to do a community.
Well, I wanna say-
community uprising, and I have to relate this to what we did in the '60s and '70s. Well, actually in the '30s when the work was done with the black dolls and the white dolls, and our kids tended to prefer the white dolls first. It actually was a community activism, a change in the perspective of the community that shifted the perception, the liking of the black dolls again. I think we're going to have to do the same kind of thing. Again, working at the grassroots level, working for young people to say, look, this is not the model. This isn't cool. This is not the model. This is not a good thing that we want to have in terms of showing not only to the rest of the world, but also to ourselves.
Well, I just want to say thank you all for coming today. And I love the fact y'all talk about this research, and one of the things I always say is I wish you guys wouldn't just write for the journals, or you could translate that information into something that, you know, the average reader gets a hold of. There's no way I can get a journal. You know, I can't afford all those journals that you guys are published in. But if there's some way to, you know, go into mainstream media with this information, or send it to black newspapers in an article so that we can use this information. I mean, as somebody that does policy work and goes up to the Hill, it's really hard to, you guys are like, oh, we did some research. CDC says it to me all the time. I'm like, how do I know? And so it would be great, because activists like myself would love to be able to take your work and leave it behind and talk about it and make my point. So I just want to advocate that.
Invite us to participate in your blog next time you have it up there.
Huh?
You want us some content for your blog? Let us know.
No, I don't blog, but I do go up to the Hill,
That's
so
right.
I will
Okay.
take it with me, yes. But I know some people who do blog, so.
Great.
So I will leave you with this, because I was trying to take some notes here from, I think, some actionable steps that were recommended from the speakers. So pretty straightforward one, too, I think. So asking for more mental health services in schools, not an easy job, but something that needs to happen. We need more than school nurses. Forming community groups to build interest on the issues that we discussed, and helping to build consensus around the need for more dialogue and awareness about the issues.
Can I interject one thing? In the 70s, I forget when the statute was, when it expired, but we used to support in what was ADAMHA, the 4 core disciplines in clinical training. And then, because of a number of things that went on with the administration of the time, they eliminated most of the clinical training support. Now we're at a point in time where I'm not sure that we can field all of the behavioral health people that we need to support the care that we need in the next 25 years. So that means that we're going to have to begin to invest in social workers, psychiatrists, psychiatric nurses, and psychologists in a systematic way, and we need to make that recommendation.
Okay, very good, thank you. As Lisa mentioned, educating and empowering young people to become more critically and socially aware. And then certainly speaking out, and this is probably, you know, one of the ways that's probably easiest, but that we often don't do, speaking out when we're seeing policies that, well, first of all, we have to know about policies that are in place, right? That's number one. And then 2, finding out about how there's infringement of those policies that's happening in a very systematic way, and that ultimately is really becoming detrimental for our communities, and speaking out against those.
And let me also add, again, we have something called the Affordable Care Act.
Yes, we
It has
do.
a lot of very useful elements of it. There's a strong effort to repeal parts of it, and we need to be made aware that there's going to be a strong effort to get rid of it. One of the interesting parts of it is for the expansion of Medicaid is that there's a gap between when people released out of the correctional system and go try to get services in the community. In the past, Medicaid doesn't cover that. Also didn't cover while folks were in correctional systems. Now that does happen, and it serves as part of the link to getting mental health and substance abuse services when the people leave the correctional system. Also, the Affordable Care Act also brings a parity in terms of mental health and also substance abuse, and now allows support for substance abuse services where we didn't have it before. So there's a lot of elements in the Affordable Care Act that I think addressing some of these concerns, we have to make sure that the act and all of its elements remain intact. And then, of course, there's the Bradley and the Murphy bill, which is there's a lot of criticism, but at the same time, they do try to address some of these concerns as well.
May I add something with regard to HIV? I think that we need to insist on HIV educational information continuing in our communities. To push us all into PrEP studies, I think is really criminal, because everyone doesn't even know what they're doing sexually. We've said that for the last 2 hours. We need to allow people to come to the decisions that they need to make about their lives and bodies by educating them and offering them an opportunity for counseling and for sorting through the decisions they've made about sex or their sexual orientation. Every community is not at the same place, and we need to allow those people who need case managers and counseling and groups to have that, and then move them towards testing if they are ready, if they are at risk. But to insist that everyone be on Truvada, I think is just really simplifying what really needs to be done in any community. And that is, we have a variety of resolutions and a variety of sources of change that may be appropriate for different people at different times in their lives. And that's why I started saying that what we're pushing now is something appropriate for middle-class people who already are health literate and who don't have issues with going to the doctor and trusting. Our communities have a lot of mistrust, healthy paranoia. We need to acknowledge it and we need to work with it. But to insist that everyone does the same thing and that everyone's going to change, I think is going to leave a lot of people behind. So allow the Black community to take its time to catch up with about 200 years of the lack of health literacy that we just don't have. And we'll get there, but only if we demand that people don't try to rush us and consider us not to be a problem. We are part of the solution. That's why we're still here. But let's demand that we be treated as such.
Please give them a round of applause.
I just
Sure,
wanted
Tara.
to mention, because a couple of people had asked me before, I have about 4 copies of Black Pain. It just looks like we're not hurting if anybody was interested. That's all. I'd be happy to sign it for you.
And thank you all so much for being here. And enjoy the rest of the conference. Thank you so much, everybody.